Trach site care is a two-person job. First, make sure you have your emergency equipment available. Wash your hands and put on gloves. Gather supplies and place on a clean surface. Cut new trach ties to the desired length. Lay your child on their back and place a blanket roll under their shoulders so the trach site is visible. Have one person hold the trach in place. The other person will change the ties. Undo the Velcro on one side of ties and remove the tie from the trach. Gently wash the skin around the stoma with a cotton swab or gauze moistened with normal saline. Start closest to the trach and work outwards. While cleaning, check the skin for redness and/or soreness. Repeat with a dry swab or gauze. Use a wet and dry gauze or washcloth to clean the neck. Replace the dressing. Replace and secure new Velcro ties. You should only be able to fit one finger between the ties and your child's neck when your child is sitting or lying on their side. Call your healthcare provider with any concerns about the skin or stoma site.